Hi friends, welcome back. We're going to talk about lactation and infant feeding. So let's start out. We're going to talk about why it's important to make a plan. So it's really common for folks to have strong feelings about how they want to feed their baby. Um, we've all been raised with a lot of different information and social expectations around what is best, whether that is formula or whether that is body feeding, how long, when, where you should do it. There's a lot of strong feelings and information that spiral around when it comes to what you should do in order to nourish your child. And what I want to say about that is that fed is better than starving. And while we know that there's a lot of science to support that body feeding has a number of like immensely huge benefits for the health and well-being of a child into adulthood and developmentally. It has a lot of protective factors. Sometimes that's not an option for people. Sometimes it's just not. Sometimes, people have a hard time establishing supplies. Sometimes people don't want to. Sometimes, due to separation of parents and babies, we don't always get to have the feeding journey that we want to. And sometimes, we want to formula feed and then we change our minds. It's very common to change your mind once you have more information or once you meet your baby and you kind of weigh the costs and benefits, or you give one option a try that you had previously been more closed off to, and then you decide like, hey, maybe it's okay if I supplement with formula, or I formula feed my baby, or I want to initiate a latch, which is when you feed baby from your own chest, or however you feel comfortable referring to it. Some people like to call it breastfeeding, some people like to call it body feeding, some people like to call it chest feeding. Whatever makes you feel more comfortable is what you should refer to it and what you should refer to your body parts as. For the sake of including as many people as possible, I'm going to refer to it as body feeding. You might initiate body feeding and find that you don't really like it, or that you would prefer to use your own milk supply, human milk, but pump and bottle feed with it. And that is totally okay and totally normal. We want you to have all of the tools and all the knowledge and the vocabulary that you need to make a decision of how you want to feed your child. So it's really important to think about what options you are open to, and know at least some information so that you can talk to your providers and who those providers are that can help you if you have questions or need some support or more information. So let's get into a list of vocabulary. So we can do, like I said, body feeding, we can formula feed, we can combination feed, which is when you feed your baby a combination of both human milk and also formula, and you might also latch, you might also bottle feed. When you're doing so, there are some techniques that can help to make sure if you still want to latch and you don't want to exclusively bottle feed, that your baby still is able to kind of like navigate between both, because they do have different sensations and feelings in the mouth. So with bottle feeding, they might get a continuous supply of milk, and that doesn't quite mimic the letdown, which is just basically the flow of milk through the chest, out the nipple, and into the baby's mouth. I can drop a link to pace feeding, or you can Google it, but it basically is a technique of bottle feeding that helps use a combination feed a little bit more successfully if you're looking to both latch and bottle feed, without the risk of your baby becoming too comfortable with a bottle and kind of not latching as consistently or as well as they were previously. There is also SNS, which stands for Supplementary Nursing System. And a supplementary nursing system is really helpful if you are wanting to do skin to skin bonding and feeding with baby, but you either are not able to produce human milk, you're not lactating, or you're not getting the supply, or baby's having a difficult time latching. And this can be done with using human milk. It can be done with using donor milk. It can be done with formula. And what it does is it basically is a device that you can hang around the neck, or you can hang at an elevation with a little tube. And sometimes you use it with baby at the chest and help to support getting the latch by feeding the tube into baby's mouth at the same time that you're trying to get the latch. And sometimes you just allow baby to feed through the tube itself, and you can help do that by taping the tube to the chest. We can also syringe feed. So the syringes that we use for assisted feeding are not syringes like you would pick up at a needle exchange with a needle. It's a needleless syringe. And so you would fill it with formula or with human milk, and you can attach a tube to it, much like the SNS, feed it into the roof of the baby's mouth, often using a finger, and push the syringe down a little bit to get the milk to flow through it. And then once baby starts sucking, it will start to pull the milk through without needing much more assistance. And that can help baby get used to that sucking motion that they would need to create a latch. It can also be a good way to initiate feeding human milk to your baby. Then again, it can also still be done with formula, and they typically have those supplies in labor and delivery, and in not in labor and delivery, in the postpartum suite at the hospital. Spoon feeding and cup feeding is another way that can be supported. Similarly, just trying to get a little bit of a taste or a small amount of milk or formula into baby's mouth and allowing them to swallow without a latch. These are oftentimes not methods that are used exclusively throughout the duration of a baby's feeding journey. I don't actually know of any instances where they are, but they are ways that you can they're supportive means for getting a baby fed, and also for supporting whatever feeding choice that you make for your child. I want to highlight NICU babies' experiences. So if baby gets taken out of your care or transferred to the NICU, it is within your right to make very, very clear how you want your baby to be fed. So if you would like to supply your baby with human milk and you don't want them to access formula, it's very important that they know that. Some hospitals have donor banks. Some hospitals, they should allow you to pump and transfer your milk over there. And you should also be able to visit baby in the NICU. If you're not able to visit baby in the NICU, maybe you're in a treatment program that you have to go back to, or otherwise, like, coming up with a plan for how you're going to get your milk to your baby is something that hopefully you can help facilitate with your support people, with your doula, and coordinating with the hospital. There should not be a reason why you cannot do that. The only reason that I can foresee that they will prevent you from from feeding your baby human milk is if they are unsure of what substances are present in that milk supply. So oftentimes in the beginning of postpartum, right after labor and delivery, they will not let you initiate a latch if they know or are unsure of your current substance use status. That being said, you can initiate body feeding when you are 72 hours free of stimulants from your supply. So if you take a Utox and it is clear for stimulants, you can initiate body feeding. I probably have talked about this in the Know Your Rights video. So if you decide that you do not want to take a Utox, that you do not want baby to take a Utox or be tested, and you've advocated for that, and they say, we're not going to let you initiate body feeding, even if you have requested MAT in hospital, whether that's Suboxone or Methadone, you can request to be re-Utoxed at 72 hours if you feel confident that you are not going to show up positive for stimulants, and you should be able to start feeding your baby human milk. We want to make sure that if that is your choice to feed your baby with your own milk supply, and you have to wait, that you have access to a pump. The reason this is really important is because we want to start stimulating your body to bring down your milk, bring in your milk supply. So ways that we can do that, supportive things that we can do, is doing skin to skin with baby. Bonding with baby releases hormones in your body like oxytocin that help bring in your milk supply. We also want to stimulate your milk supply through suction. So whether that is trying to establish a latch when you're able to do so, or if you are not able to do so, getting a pump in can help bring down your milk and start establishing. So even if they've said, you know, you cannot feed baby your own milk supply just yet, you can still pump and dump. On that note, let's talk about human milk and what it consists of. So oftentimes we don't talk about this. Like, I really didn't even know actually until I started becoming a doula, that your first milk, the first milk that leaves your body, is called colostrum, and it's often referred to as golden milk. So colostrum will come out thicker, sometimes more yellow, and it's because it's very, very nutrient dense. It helps to reduce inflammation and promote ligament and muscle healing, and supports a healthy gut in baby. So it actually helps seal the gut in the baby and prepare it for further food intake. So some people like to collect their colostrum. Some people like to if it starts to come out, sometimes your colostrum will come out before baby is born. If you are confident and know that you are stimulant free, you can store, you can collect and freeze your colostrum and store it for 2 to 3 days. It will stay good for 2 to 3 days. So that is an option that you have available to you, and knowledge is power. A lot of people talk about human milk being the ideal nutrition because it contains antibodies to help babies fight off viruses and bacteria. And that's important to helping babies adapt to a new environment. The world is full of germs, full of bacteria and things that babies' bodies are going to have to get used to. And with a latch, that your baby is communicating through their saliva to your body what antibodies that they're being exposed to, and your body is actually producing, what bacteria and pathogens their body's being exposed to, and your body's producing antibodies to help protect your baby from those very same bacteria and pathogens. Body feeding can also lower SIDS risk. So especially with babies with low birth weights, which can be common with folks who have used substances during pregnancy. We don't exactly know why. It can also be linked to stress and a lot of other factors. Low birth weight babies have a higher risk of SIDS. And so body feeding your baby is statistically shown, it's been proven through a lot of studies to reduce SIDS risk and lower mortality. It also helps promote their waking reflex. So babies who are body fed tend to wake up more often and feed more often. Waking up is a life-saving reflex. We know that SIDS is related to babies not having that wake-up reflex, and they stop breathing in their sleep. So it also reduces the risk of vitamin E and iron deficiency. So it helps reduce jaundice, which can happen. It's one of the reasons why a baby might get admitted to the NICU. So for NICU babies in particular, it's very highly recommended that they are fed with human milk because of some of these properties. But if you're not able to, I don't want you to feel any sort of shame or guilt or fear that your baby's not going to be okay. There are millions of adults walking around on this earth that were not body fed. There's a long legacy of people being shamed out of, or generations losing the practice of body feeding for a variety of reasons, whether that's medical racism, ableism, commercialization, and wanting to sell a product that would get more women and birthing people, gestating people back into the workforce so that they didn't have to be at home nursing their babies. So those formulas are supplemented with a lot of vitamins and nutrients. And again, sometimes formula feeding is a harm reduction measure. It's a life-saving measure. It keeps babies fed. It keeps babies healthy. There are just some things that are different about formula feeding in comparison to body feeding that we need to be mindful of, and both are really great options, and everyone has their reasons for why they choose them. So with formula feeding, it's a good option if you want to not have more options for who gets to feed baby. So if it's really hard for you to keep up your milk supply, if you aren't able to be physically present, if you can't store your milk, if you can't pump and like make bottles with your own milk supply, constantly having formula as a way of supplementing or exclusively feeding baby gives the option to more people to help with, like, take on the load of feeding. Feeding an infant can take 35 hours a week, and is a lot of labor for a person who is exclusively body feeding or feeding human milk to take on. Things can also occur with body feeding, like mastitis. It is when like there's inflammation in the chest tissue or a clogged duct. So that can be really painful, and sometimes you might want to like supplement with formula. Hot compresses, massage, trying to move the milk and the inflammation down are also really helpful for that. Formula feeding can also be expensive. There are programs that help to support formula feeding, like WIC, and some food banks will carry formula, but it can be quite expensive. So we want to be mindful of the fact that we know that new parents are oftentimes under a lot of financial stress, and that can be really hard, but we also don't want to devalue the worth of human labor that it takes to feed an infant with your own milk supply. That's a lot of time. It's a lot of energy. So both come at a cost. and we need to value the costs that people who are feeding their infants are taking and help support that. That's another light bulb, ding, ding, ding. If you're a support person, how can you support a new parent in their feeding journey? Making sure that folks have access to the bottles and the pumping equipment, bottles, regardless of what feeding method you're using, are super important, and also come in a lot of different shape, size, like nipple configurations for baby, and can make a huge difference. So making sure that you try out and find what you like, and that you have access to do so, whether that's swapping out with different folks. Like one bottle might work really well for one baby and it might not work very well for another baby or another family. So making sure that you are aware that it's not like a one size fits all, just like your feeding journey isn't a one size fits all. I hope that this was helpful. Again, this is not exhaustive. I'm gonna really quickly run through what other supports might be available, because I am by no means a infant feeding and lactation expert. I am a full spectrum doula and a childbirth educator, but I am not a lactation counselor, which is somebody who's received some specialized training in infant feeding. Some nurses, especially nurses in labor and delivery, the NICU and postpartum unit, have gone through a infant feeding training. Above that, there's IBCLCs, and those are folks who have gone through basically an entire like higher education, like college curriculum, 95 plus hours of training, and have more specialized knowledge of not just like common feeding issues that may arise, but more specialized needs. And IBCLC is a great resource. A lot of hospitals have them. There's some great community resources in the Seattle area and virtual lactation lounges that we can link you up to. And then I forgot to mention, there's also lactation consultants. So those are a little bit more specialized than lactation counselors, but they're not always IBCLCs. So making sure that you are asking for the folks that you need. If you're talking to somebody and you're having a feeding challenge and you're just not really getting answers, or you're like kind of confused, ask them what their level of training is, and if you can like move up to a newer level of training or get a resource for that level of training. Thank you all for being here. Thank you all for listening. I hope that this was helpful in considering what feeding options will work best for you, and I hope it gave you some vocabulary and some knowledge moving forward, and look forward to talking to you soon. Drop your comments and questions in the chat. Bye.